AATB questions and answers latest. Version already passed. 1. When handling sterile drapes, you must be sure that the drap E is presented. A. To a sterile person who is scrubbed, gowned, and gloved. B. Using quick movements when placed on your table. C. Prior to the surgical prep of the donor. D. After being sterilized using ETO to a sterile person who is scrubbed, gowned, and gloved. 2. The Achilles tendon is attached to which bone? A. Calcaneus. B. Fibula. C. Talus. D. Tibia. I. Calcaneus. 3. Refrigerated skin may be returned to inventory if it has been maintained in a closed container at A. -20 to -40 degrees Celsius. 1/4. B. -40 degrees Celsius or colder. C. 1 to 10 degrees Celsius. D. Ambi température C. 1 to 10 degrees Celsius. 4. The most accurate way to test for the presence of contamination of tissue allografts is by A. A gram stain of the graft taken prior to final packaging. B. Cold tours of blood and of the excised tissue of the donor at the time of recovery. C. Incubation of spore strips in bacterial growth media. D. Incubation of selected grafts or samples in bacterial growth media. B. Cultures of blood and of the excised tissue of the donor at the time of recovery. 5. Receiving permission to obtain tissue from living or non-living donors in a manner that provides the donor or the donor's next of kin information in clear and understandable terms, referred to as A. Durable power of attorney. B. Advance directive. C. Informed consent. D. Required request. AOEC. Informed consent. 2/4. 6. When preparing a donor for a septic bone recovery, the extremities should be prepped. A. From clean areas to dirty areas. B. From dirty areas to clean areas. C. From proximal to distal. D. After dropping from clean areas to dirty areas. 7. A negative test results means that the agent of substance being tested for is not A. Active. B. Present. C. Detected. D. Able to be tested. AOEC. Detected. 8. All reagents used in MS tissue processing must be A. Sterile. B. Isotonic. C. Approved by the medical director. D. AATB approved. Sterile. 3/4. 9. Which of the following is not considered an acceptable method of sterilizing tissue for implantation? A. Steam autoclave. B. Electron beam irradiation. C. Gamma irradiation. D. Ethylene oxide I. Steam autoclave. 10. Information that a potential donor has received 12 units of packed red blood cells in the ore prior to death should be considered A. Relevant to HIV testing. B. Relevant to the dilution effect on all antigen/antibody testing. C. Relevant to HBsAg testing. D. Irrelevant because transfused blood is screened AOEB. Relevant to the dilution effect on all antigen/antibody testing. 11. Which of the following is most important for effective donor skin prep? A. Extended prep time and applied pressure. B. Mechanical and extended prep time. C. Friction and heat powered by TCPDF. www.tcpdf.org. For /4.